SVD may also be effective after T-cell redirecting therapies, and this is also present in the International Myeloma Working Group recommendation for treatment after T-cell redirecting therapies, where SVD can play a role. Hello, I'm Elena Zamagni from Bologna, Italy. So here at IHA in Milan, during my presentation, I used two clinical cases to go through some important points for the routine practice in relapsed refractory multiple myeloma. So those two cases were the first one in early relapse, so the choice of second-line treatment for an elderly frail patient coming from first-line therapy with Daral and Dex, and our choice was SVD. And I think that the main reason for this choice were, of course, the good tolerability of this regimen in a frail patient. The patient got a lot of infection and several other comorbidities. At the same time, the efficacy results, of course, of the combination, and the possibility for that patient not to use anti-BCMA-directed therapy. So in case the patient become eligible later on for T-cell redirecting therapy, this can be easily preserved. The second case is a different one. It is an 8th-line choice of treatment. So for a young fit patient who went through, I must say, all the available treatment options. So a penta-refractory patient and more, receiving BTD, carfilzomib, pomalidomide, and even belantamab mafodotin and talquetamab. In that patient, we chose SVD in a situation where there was also extramedullary disease. And what we saw, it's an excellent response that is still ongoing, a metabolic response also by imaging and also in the extramedullary sites of the disease in this very advanced patient. So here the concept is that SVD may also be effective after T-cell redirecting therapies, and this is also present in the International Myeloma Working Group recommendation for treatment after T-cell redirecting therapies, where SVD can play a role, as well as can play a role in between two different T-cell redirecting therapies or as a bridging therapy prior to CAR-T. So I think that these two different roles of SVD maximize the efficacy in earlier lines, preserving toxicity is one point, but also ferrying the patient maybe farther in later lines after or among T-cell redirecting therapies.